Mr. Siddaramaiah, our Honorable Chief Minister, and Kiran Majumdar also said, this is, he has been proved wrong. As an elderly statesman, he has done his responsibility because every life counts in Karnataka. Every Kannadiga's life counts. So when there were reported so many deaths in one district, as an elderly statesman, he didn't sleep on that report. He asked the chief of the Jaideva, Mr. Ravindranath, and Dr. Ravindranath is there. He made a committee of virologists, community medicine people, heart surgeons to go there, find out. And I went through the report which came in the newspaper. They also went and made a study of around 178 or 200 people. And now we are all safe. That is statesman Siddaramaiah who has acted on some information which
right. I agree. I appreciate what Mr. Siddaramaiah did. But let's come to the point, Satya. I am asking you, what is the way forward, sir?
The way forward is the experts. Dr. Ravindra and his team has given some suggestions. Let us read the report. And they are the heads. They are the medical fraternity who has to teach us.
Then why did Siddaramaiah jump into it? You are right. Satya Prakash, 100% right. They are the experts. Then Siddaramaiah should not have jumped and created this panic, because my mother who lives in Bengaluru said, my God, I am going to Hassan. Will I die because I have a vaccine? I'm sorry. No. Let experts talk. And I'm going to invite one expert right away. But I want to ask Satya Prakash, who is today a representative of the government which is ruling Karnataka. Satya Prakash, if according to Mr. Manju, it is not only Hassan, it is happening all over Karnataka, then you have a health crisis. Would you say you have a health crisis? Because he attributes it to lifestyle. So don't you think your state government should do something about arresting these attacks, sir?
Absolutely, I agree with what Dr. Ravindranath says. I think his report should go intensively into this. And what are the preventive cares that can be taken? How many people check their, H1A1C, HbA1C to know what is their sugar levels? Because that is the worst thing. Diabetes, is the worst killer as far as heart attacks are concerned. Second thing is, how many of them check their, cholesterol levels and all? Not many. After all this, I made up my mind that I am going to go in the next 1 week to Jaideva and have my routine checkup. Second thing, what I want to ask Dr. Ravindranath is, as per British, Cardiac Society, they say that mRNA, there are chances that mRNA vaccines leads to myocarditis and, another inflammation of the heart lining. Which are the two vaccines, if at all, Covaxins and Covishield, is there any mRNA part involved in it? Can you throw some light on it, doctor? Because people are really worried about this when they read these reports. What do you feel, is the mRNA involved in either Covishield or Covaxin? And as per the British Cardiac Society, which says that mRNA vaccines used, there are studies which say that which leads to little more incidences of heart attack. What do you feel, Dr. Ravindranath? I want your expert listening on this.
Covishield or Covaxin, mRNA vaccine was received in the abroad, Western countries. There was some slight increase in the incidence of myocarditis, not very gross. So maybe if you take 1 million people, some 27 people had myocarditis, and subclinical myocarditis was little more. That means patient had, as I told, COVID is a diffuse inflammatory disease.
Will you wait for 10 days or 15 days for the panel, for the Jayadeva Institute panel to come up with what could be the causes? Meanwhile, what is your health minister trying to do? I mean, is there any which way by which you will curtail this? I'm asking you this once again because much like you also accepted and much like Dr. Sridhar said, there is a bit of a worry here.
See, if at all, the golden hour is very important as far as heart attacks are concerned. Dr. Ravindranath will agree with me. We will see if according to Dr. Ravindranath's report, if golden hour was missed in few cases. If that is the case, we have to separate our ambulances and all correctly. We need to do a lot of, informative programs we have to give in case of an heart attack. Right. What should they do? Should they keep an aspirin in place? What is the, what are the other measures they take? And our public health centers and all should be, they are not so good in heart care. So we need to sensitize them. Maybe Jaideva can start one small program of all the public health centers there to know in case of an heart attack what are the start with within that golden hour what else they can do. Definitely, if some interim report before 10 days, some interim report can be orally submitted to the health minister or the CM by Dr. Ravindranath and team. We will definitely act on this, is what we are telling. We will not let any Kannadiga's life go. We will try all our best. Kannadiga's life is very precious, is all I'm going to tell.
That's a